Welcome to a new session on the course School Organization, Administration and Management. In this present session, we will have a discussion on first aid and emergency care in the case of a shock, burns and scalds, drowning, fire and a bleeding nose. We will also discuss some health hazards of school students. Children spend most of their time indulging in various types of activities, both constructive and destructive. Therefore, it is natural for them to meet with accidents while playing, running or jumping in the school campus or in the playground. While handling chemicals, gas, glass particles and acids in science laboratories, they may also meet with accidents. Due to climatic changes, they may shiver, faint and swoon. In this situation, immediate help should be provided to the affected children before actual medical treatment. Besides this, one may not contact a doctor at all places and all moments. Therefore, in between accident and proper medical treatment, some effective treatment in an emergency situation is technically known as a first aid. First aid is the immediate care given to victims of accidents before trained medical workers arrive. Its goal is to stop and, if possible, reverse the harm. It involves rapid and simple measures such as clearing the air passageway, applying pressure to bleeding wounds, or dousing chemical burns to eyes or skin. First, we shall have a discussion on shock. Shock is that feeble condition of the nervous system which is the result of a sudden accident. Electric shocks are very common. Symptoms of shock: weakness after fainting, especially on standing up, vomiting sensation, cold damp skin, too much sweating even in cold weather, severe thirst, restlessness, mental confusion or loss of consciousness, and weak rapid pulse more than 100 per minute. Treatment of shock: have the pupil lie down with his or her feet higher than their head. If the shock is due to a head injury, do not raise the feet. Make them sit propped up, that is half sitting position, against a pillow. If the pupil feels cold, cover him or her with a blanket. If the pupil is conscious, give them warm water or other lukewarm drinks. If the shock is due to injury like accidents or stab wounds, then do not give anything to drink. Get medical help fast. If the pupil is in pain, give aspirin or any other pain medicine. Keep calm and reassure the pupil. Next is electric shock. Electricity can enter the body from any live point of contact. It then seeks its way through tissues and out of the body along the easiest conduction paths open to it. Water is a good conductor. Wet skin offers danger when in touch with electricity. Most metals are good conductors too and should be properly insulated on electrical apparatus. Current, which is given an opportunity to reach earth, will take it. The electrocuted man is at the highest risk if he himself is earthed. He or she might be standing directly on the ground wearing footwear which offers little insulation. A really perilous situation is when one is touching live terminals while the feet are on a metal substance leading directly to the ground like a bath or water pipes. Effects of electricity: electricity can burn. Its point of entry into the body shows charring of the skin. The surface area may look deceptively small and innocuous, but beneath it, the current could have fanned out, damaging muscles, nerves, and blood vessels. Even the smallest mark on the skin merits medical advice. Electricity can send muscles into spasm. This could tear muscle fibers and, in particularly severe cases, cause a fracture of bones to which strong muscles are attached. Sometimes the muscles of finger, which have inadvertently grasped a live object like electric appliances, contract firmly around it. The victim cannot let go and remains in contact. However, the violent muscle spasms throw the body some distance with the risk of fractures. Electricity can kill. Now the first aid. Disconnect the victim from the current at once. That is, switch off the current or pull on the plug or its insulated cord to free it from the socket. If the patient has stopped breathing, use artificial respiration. Check for other injuries and treat them like fracture, wound, dislocation, etc. Keep on watching your patient. Burns and scalds. Meaning of burn. When the body is burnt with something hot or a flame, it is called burn. Meaning of scalds. Scald implies burning with steam, hot liquid matter like ghee, milk, oil and water, etc. Burns are a major cause of accidental death among children. They are caused by extremes of temperature, hot or cold, friction, chemicals or radiation. Scalds are burns caused by wet heat such as steam or hot liquids. Electricity is another possible cause of burns. Burns and scalds are serious because as the skin is broken, they allow infection to enter the body. Superficial burns affect only the surface layers of the skin. The skin will become red soon after the burn. Deep burns go through the layers of the skin and the skin may be grey and charred. There are three primary types of burns: first, second and third degree. Each degree is based on the severity of damage to the skin, with first degree being the most minor and third degree being the most severe. Damage includes first degree burns, red, non-blistered skin. Second degree burns, blisters and some thickening of the skin. Third degree burns, widespread thickness with a white leathery appearance. In this figure you can see the first, second and third degree burns. Treatments for a burn include: you should contact a doctor or hospital if there is a burn or scald. If it covers an area more than 1 centimeter in diameter, is deeper than the surface of the skin, has been caused by an electric current, is anywhere on a baby. Blisters. Small bubbles of fluid may form under the skin after a burn. These are caused by body fluid leaking into the burnt area under the surface of the skin, and during healing, a new skin will form under the blister. You should never break the blister on purpose, as this will increase the risk of infection. For all burns, stop burning immediately. Put out fire or stop the person's contact with hot liquid, steam or other material. Help the person stop, drop and roll to smother flames. Remove contact material from the person. Remove hot or burn clothing. If clothing sticks to skin, cut or tear around it. Number 2, remove constrictive clothing immediately. Take off jewelry, belts and tight clothing. Burns can swell quickly. Then take the following steps. For first degree burns, or affecting the top layer of the skin. Cool burn. Hold burned skin under cool, not cold, running water or immerse in cool water until pain subsides. Use compresses if running water isn't available. Protect burn. Cover with sterile non-adhesive bandage or clean cloth. Do not apply butter or ointments which can cause infection. Treat pain. Give over-the-counter pain relievers such as ibuprofen like Advil or Motrin, acetaminophen like Tylenol or naproxen like Aleve. When to see a doctor? Seek medical help if you see signs of infection like increased pain, redness, swelling, fever or oozing. The person needs a tetanus or booster shot depending on date of last injection. Tetanus booster should be given every 10 years. The burn blister is larger than 2 inches or oozes. Redness and pain last more than a few hours if pain worsens. Next, follow up. The doctor will examine the burn and may prescribe antibiotics and pain medication. For second degree burns, that is affecting the top 2 layers of skin. 1. Cool burn. Immerse in cool water for 10 to 15 minutes. Use compresses if running water isn't available. Don't apply ice. It can lower body temperature and cause further pain and damage. Don't break blisters or apply butter or ointments which can cause infection. Protect burn. Cover loosely with sterile non-stick bandage and secure in place with gauze or tape. Prevent shock. Unless the person has a head, neck or leg injury or it would cause discomfort, lay the person flat. Elevate feet about 12 inches. Elevate burn area above heart level if possible. Cover the person with coat or a blanket. Consult a doctor. The doctor can test burn severity, prescribe antibiotics and pain medications, and administer a tetanus shot if needed. For third degree burns, call ambulance service. Protect burn area. Cover loosely with sterile non-stick bandage or for large areas a sheet or other material that won't leave lint in wound. Separate burned toes and fingers with dry sterile dressings. Do not soak burn in water or apply ointments or butter which can cause infection. Prevent shock. Unless the person has a head, neck or leg injury, it would cause discomfort. Lay the person flat. Elevate feet about 12 inches. Elevate burn area above heart level if possible. Cover the person with coat or blanket. For an airway burn, do not place pillow under the person's head when the person is lying down. This can close the airway. Have a person with a facial burn sit up. Check pulse and breathing to monitor for shock until emergency help arrives. See a doctor. Doctors will give oxygen and fluid if needed and treat the burn. Drowning. Drowning is defined as a respiratory impairment from being in or under a liquid. In a drowning emergency, the sooner the victim is removed from the water and first aid is administered, the greater the opportunity the victim has for surviving. The focus of the first aid for a drowning victim in the water is to get oxygen into the lungs depending upon the circumstances. If there is concern that a neck injury or a possibility, care should be taken to minimize movement of the neck. Drowning causes asphyxia either by water flooding into the lungs or by causing the throat to go into spasm, thereby blocking the airway. Quick action can save the victim's life, and your priority is to get air into his or her lungs as fast as possible, if necessary, even if you are still sitting in the water. But take care you do not put your life in danger unless you are a strong and experienced swimmer. You should not attempt a rescue from deep water or where there is a strong current. In artificial respiration, some steps may be taken. Place the person on his or her abdomen. Bend the elbows and place one hand on top of the other. Turn the face to one side and place a cheek on their hands. Position of the first aid operator. Face the patient and kneel down with one knee on each side and close to the person's head. Place your hands on the person's back with tips of thumbs touching and fingers spread out. Draw arms upward and towards you. Lift the elbow just enough to feel resistance at the person's shoulders. Keep your elbows straight as you rock backward. Lower the subject's arm to the ground. This completes the cycle. The chest expands when the arms are lifted. Repeat the full cycle 12 times per minute at a steady, regular, uniform rate. Persons have been known to revive after 1 hour's application of artificial respiration. First aid for drowning. Assessing the situation. Determine whether the person is drowning. Active drowning victims are conscious but are struggling and unable to call for help. Shout for help. Decide which rescue method to use. Proceed with the rescue. Performing a reaching assist. Lie face down on the edge of the pool or dock. Locate the shepherd's crook. It is a long metal pole with a hook on the end that can be used either as a handle for the victim to grab or as a device to wrap around the victim in the event that the victim is unable to hold on to himself or herself. Stand slightly away from the deck. Make sure the hook is not near the person's neck, since this could lead to injury. You will feel a sharp tug when the person finds the crook. Pull the person to safety. Performing a throwing assist. Find a floating aid, a ring buoy, life jacket, floating cushion, etc. Throw the floating aid. Performing a swimming rescue. Be sure of your swimming abilities. Victims are often thrashing and panicking, which can make it hazardous to perform a swimming rescue. Drive in with the aid. Do not attempt a swimming rescue without a buoy on hand. Swim to the victim, swim back to the shore. Caring for the victim after the rescue. Assess the person's ABC, airway, breathing and circulation. Start CPR. Give breaths if the person is still not breathing. Only give breaths if you are trained in CPR. Begin by tilting the head back and lifting the person's chin. Pinch the nose, cover the victim's mouth with yours and give 1 or 2 seconds breath. Watch to make sure the chest is rising. Follow 2 breaths with 30 chest compressions. Determine whether the person is drowning. Active drowning victims are conscious but are struggling and unable to call for help. Shout for help. Decide which rescue method to use. Proceed with the rescue. Some additional instructions. Start artificial respiration as soon as the person is removed from the water. Put the head a little lower than the body to allow fluid to flow out of the mouth more easily. Keep the head extended so that the neck will be straight. If the head falls forward or if the chin falls on the chest, the air passages may be cut off. Remove false teeth and see that the tongue is not blocking air passages. Keep the person warm. Have a second or third first aid operator available so that each person will work in turns of 10-20 minutes each. Maintain the rhythm when changing operators. Keep crowd away from the apparently drowned person. Now let us discuss the case of a fire. When a person's clothes are on fire, they must not run for help. Running causes a drought which will only increase the flames. They should lie down and roll on the ground, wrapping themselves if possible with a blanket or any thick cloth to put out the flames. Also, this will prevent the flames from reaching the face. Standing up will only let the flames rise up to the face, just as when you hold a struck match downwards. It burns with a bigger flame. After the flames are put out, fetch water to put out the smouldering fire. Treat for shock and burns. Health hazards of school students. In modern society, health is considered both an individual and group responsibility. This basic principle must be in operation if the quality of life is to be improved. The school is one segment of the society where this health principle is brought clearly into focus. There are certain problems operating today which obstruct the development of healthful living in the school environment, and these problems are technically known as health hazards. No doubt, technological developments today have improved the quality and standard of life, but they have created a number of health hazards in the form of accident, risk or danger. Population explosion has further increased such health accidents, health problems and difficulties, health danger, health risk, etc. These health hazards are both man-made and environmental in nature. While we can observe some of these hazards without much difficulty, there are others which we cannot. The teachers and the parents can provide necessary instructions to the school-going children to protect themselves from the day-to-day health hazards. Modern health hazards are usually created mainly from certain situations like environment, technological development, population explosion, adulteration, explosives and dampness. First, we shall see environment. The environmental problems like air pollution, water pollution, pollution of environment by noise, etc. create health hazards. Air pollution takes place due to decomposition of things, smoke from charcoal and from chimneys of factories, exhaust fumes from vehicles, industrial waste, waste from carbon monoxide, sulfur dioxide, lead compounds, etc. Because of this, we get fresh air, for want of which we suffer from many diseases. This may affect the fruits, vegetables and other agricultural products. In order to get rid of this problem of health hazards, we should try to establish industries far away from residential areas, and there must be provision for disposal of waste, excreta and dead material. Besides air pollution, water pollution also affects our environment and is a threat to our health. We can get rid of this problem by supplying pure water to the students in school. Noise pollution also has a direct bad influence on the nervous system of human beings. It affects the peaceful school atmosphere. Since it is a man-made problem, it should be controlled by state administrators. Next, we shall see the technological developments. Scientific and technological advancements have created heaven on earth. Even then, due to the increase of factories, transport and communication, nuclear energy, etc., there is pollution in environment situations. These situations create health hazard both for the people and school students. Attempts must be made to control these problems. The third comes population explosion. In a country like India, population explosion is much more. Therefore, people fail to maintain good health and quality of life. Due to poverty, people suffer from diseases. A good number of people are undernourished and malnourished. This is a great health hazard for the school students. The fourth one is adulteration. People today face difficulties in getting pure food. Adulteration is a very common practice in our social life. Spices, milk, ghee, confectionaries, medicines are all getting adulterated. As a result, it creates health hazards among people and the students. Next is explosives. In our country, when we celebrate some festivals like Dashara, Diwali, etc., we use explosives like fireworks, which are responsible for the pollution of atmosphere. They are very injurious to health and create health hazards for the students. Sixth is dampness. There are some localities having narrow streets. Sunlight never reaches these places. There are also places without proper drainage system. People who live in these damp places suffer from many fatal diseases. Now we shall see some of the steps to minimize the health hazards of school students. These steps should be taken to minimize the health hazards. 1. The government should take remedial measures to make the country free from environmental pollution. Big industries should be placed far away from residential areas. 2. Steps must be taken to impart population education so as to control population explosion. Family welfare boards may also be established to orient the people towards family life and sex education. 3. School buildings should be constructed in open places where students can get free air. Steps must be taken to make the school free from noise pollution. 4. Healthy living conditions should be provided to the people of our country. They should not be allowed to live in old and ill-planned houses. In city areas, slums and dirty colonies should not be allowed to exist because they are not fit for human living. 6th, attempts must be made to make the people aware of the problems of health hazards and the effects on our health. 7. The government of the country should take much care to protect air and water pollution. The people of our country should be encouraged to plant trees so as to protect the environment. School students should actively participate in this program of plantation. 9. Drainage system in city areas should be improved. The government must take active steps to check the adulteration of foodstuffs. In case of minor health hazards, there must be a provision for first aid in every school. Clinical help must be taken when students face major health hazards. Let us now summarize the main points which we have discussed. Human beings are susceptible to injuries, illnesses and trauma. Thus, it is always good to have some amount of basic knowledge to take care of critical situations, to keep it from going from bad to worse or till the medical help arrives. First aid is the immediate and temporary help rendered to a person in case of injuries or sudden illness before the arrival of a doctor. First aid serves as a temporary measure to alleviate pain, prevent aggravation of injury, promote recovery or save the life of an injured person. First aid is limited to the assistance rendered at the time of the emergency with such material as may be available. It is not intended that the first aider should take the place of the doctor. It must also be understood that the redressing of injuries and other such after treatment are outside the scope of first aid. We will see again with a new topic. Till then, good day.